hit the nail right on the head. It didn't matter, or it doesn't matter where in Canada or literally around the world. It's the head and the hands. And I kind of like it that way because you're almost put into a position, okay, now I can't even speak the local language for an attempt, but you still have the same damn tools, your hands and your head. And same human being, okay, they still suffer the same issues. Oh, let's deliver it, right?
Hey, everybody. Welcome to another trusted provider conversation here. We're talking all about trust within healthcare, how to build it, how to use it, when it goes away, what happens. And it's my pleasure today to be joined by Dr. Marco Deciantis. Did I say that right, Marco?
You said it eloquently and perfectly. Thank you.
Fantastic. So, Marco, you are a chiropractor just like me, but I practice down in the rural area known as Las Vegas, Nevada, quite woodsy. And you are you practice in many areas, but all throughout Canada, right?
I just finished a stint in Northern Ontario, and it looks like in a couple of weeks I'll be heading out to BC to practice as well.
Okay. Now, for those who don't necessarily know the geography up there, BC is essentially the West Coast, right? British Columbia.
You got it. Yeah.
And what's the farthest east you've gone to work?
So far, right now, it's just been relegated to Southern Ontario. However, I was entertaining a possibility of going out to Nova Scotia, so to the Maritimes or the East Coast. I just didn't working through in terms of timing.
So to put it in U.S. terms, you work the West Coast, you work the Midwest, and you're heading up towards Maine, basically.
You know what? I'm not too well versed in my U.S. geography, but that sounds
all right. Cool. Yeah, well, what I want to get into today, Marco, I know that you've traveled, and one of the great things about travel and traveling to care is you see the subtleties of the way healthcare is offered or treated in different areas, whether that's a population based on an ethnicity, maybe it's a town that's based around an industry, and the perceptions of healthcare and that, like mining towns are a little bit different within healthcare. And within all those, we have to work our best to build trust with our patients. And it's not always the same. It's not always the same things that work, And I would even say, like, if you're working in athletic populations, if you're working with golfers or triathletes, knowing their secret language can go a long way to build trust. What are the words that only that group uses, kind of the tribal language. But before we jump into that, give us an idea of kind of like what your career has been like since you graduated chiropractic college.
Great question. And it seems to definitely switch gears the last year. But when I graduated in 2012, myself and my twin brother, who's also a chiropractor, we bought a practice in Toronto, and it was with a sport med doc. So we were working with him for a couple of years. We bought the practice and we expanded. And I was doing that pretty much until June of last year. I wasn't necessarily quite fulfilled in my career. I did my sports science fellowship coming out of the college. So working with the athletic population, their language. One of the things I found was it just wasn't, honestly, I just found it notoriously difficult to work with athletes. And I tested this in terms of, just for them following through and just, listening, just to bring them to the point where they want to go to. So I started to go into public health. I was doing quite a few missions to Uganda where I was been working as a chiropractor, and right now involved in instituting a pilot concussion study in a community-based program, and then hopefully expanding that to the whole country for the medical practitioners in all their emergency rooms. So that's that. We're looking for external grant funding right now.
This is in Uganda.
This is in Uganda.
Wow.
Then the last year I ended up kind of leaving the practice, and I've been working as a locum, so a substitute contract chiropractor for the year, which has been bringing me around Canada and to Eastern Africa as well. So it's been quite a big change.
I can't remember the route you drive from Canada to get to Eastern Africa, but it's I guess just like you're not familiar with the U.S. geography, I'm sure there's a road or something. Yeah.
There's a little bit. There's a few pit stops on the way. Let's just put it that.
Yeah. Well, I use sarcasm in these podcasts to bring some humor, but I should probably tail that off. Actually, I did recently read a study that said sarcasm is a trust eroder. It erodes trust, right? Because people perceive you're making fun of them. So I'll work on that. But Marco, what I wanted to do in this podcast is not just talk about the positives, like you're going to Uganda, providing care, which is great. And, for those listening, locum care is a term within chiropractic. I don't hear it in other healthcare populations, but a travel nurse is essentially, travel care, you're just covering somebody when they're on vacation or maternity leave or, they're doing a fellowship abroad or something. So it's providing coverage. But the other great thing, one of the things I think is the best about being a chiropractor, and obviously this podcast is for all healthcare providers, but one of the best things is when you go to any population, whether it's Uganda, I did some weekend, I don't know if I'd call it a mission, but some weekend, work. You show up with your hands and your brain and you got your full treatment abilities right there. You don't need any MRI machines. You don't need to wait 4 to 6 weeks. And there is something to be said about that. It's pretty exciting.
You hit the nail right on the head. It didn't matter, or it doesn't matter where I am in Canada or literally around the world. It's the head and the hands. And I kind of like it that way because you're almost put into a position. Okay, now I can't even speak the local language. There is no we're in a tent, but you still have the same damn tools, your hands and your head, and same human being. Okay, they still suffer the same issues.
Yeah.
Oh, let's deliver it, right?
I love it. Yeah. And you treat in the airport on the way there. That's what, it all works.
If we might have to have a separate conversation between the two of us in the interesting ways in the wonderful places we've treated.
Oh yeah. I've treated on a park bench. I've treated, and you realize they're a little too hard. I've treated in hotel rooms, and you realize mattresses are a little too soft. I treated I treated on a private airplane one time, and I brought my kettlebells for rehab, and the pilot looked at him. He's like, "That's not coming on board." And I was like, "What do you mean?" He's all, "Turbulence plus a 50-pound hunk of iron is not a great combination. That is not coming on my aircraft." I'm like,
well, good call.
I'll go ahead and put it back in the truck. Thanks.
Imagine a practice where patient engagement is seamless and unified. With TrustDrivenCare, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. TrustDrivenCare is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
So let's talk about the downsides. I know you had a story about some negatives, and I want to kind of just peel these apart to make sure that we're all on the same page on how we can improve this system. I think that I hate just coming out and saying healthcare is broken. I think there's a lot of amazing parts of healthcare. I think the advancements in healthcare from anywhere, like how we do diagnostic imaging, right? Like the advancements of MRIs, the advancements of CTs, the testing we have nowadays for whether it's a bloodborne disease or a virus or whatever, it's amazing. And I hate saying it's broken, but I think there's always room for improvement. And that's what I want to talk about in this podcast. And one of the ways I think that we can do that is, we talk a lot about trust. And I think the reason for that, just so everybody understands, if you have explicit trust and before that person ever walks into your office, I think everything improves, meaning they're much more honest in their history. They're much more honest with testing, whether something hurts or doesn't, or they can't feel something, they're going to be much more honest. And then when you're discussing the treatment plan, if they trust you, they're much more accepting or willing to do it because they know you have their best interests at heart versus the battle of you got to take this medication twice a day, or and the person saying, I don't like pills. And you're thinking, well, we don't have a lot of options here. You have a disease like that's best, antibiotics are the best treatment for that. And then also from a business side, when they trust you, they refer their friends and family, and that's not a bad thing. So with that, what has your experience been, and can you maybe cite a time where you saw the trust eroded from healthcare?
Very much so. And Josh, first and foremost, I love the way that you set this up. You're enhancing that patient experience before they even come in through that door. That patient experience is absolutely critical, for them reaching their own healthcare goals and you bringing them there. I ended up wrapping up a locum that was about 8-9 months in Northern Ontario, small mining town, believe it or not, as well too. Absolutely fantastic in the sense of the openness of all the people that I met, just to make me and welcome me to be part of the community. One of the things that I kept on hearing colloquially is, it's a small town, it doesn't have the big city problems. One of the things that I firmly believe, and once again, just my own lens and own experience, is it doesn't matter if it's a small town or a big city, they all have the same problems. It's just, I think when it's smaller in terms of population, they just become that much more apparent or much more intensified. And one of the things that I wasn't expecting that really did impact me was the local Aboriginal population that I was serving, the amount of barriers that they had towards healthcare. And, growing up in this country, I mean, and just as you preface it, there's lots of greatness inside of healthcare, but there's also those pockets that really do need improvements. And just sit there in front of one patient and me just asking, I've referred you to the hospital 3 times to get a particular image and you're back here and we're not getting this. Like, what the heck is going on? And having that individual look at me slightly cockeyed in the sense of if I'm completely naive or if I'm being, completely BS. But it was one of those things where I was almost out of the loop in the sense of how things were operating over here. And let's just put it this way. Thankfully, they got in. 24 hours later, they would have expired. They ended up having bacterial meningitis and lived.
Yeah, that's ramping up exponentially, right? Like bacterial meningitis is, for those that don't know, that's an infection within the fluid of the spinal cord and brain, right? And because that is such a hard area to get into biologically, basically, when the bacteria does get in there, it's the biggest rave party ever, right? It's unlimited supply of nutrients, a protected environment, and no natural predators within there, right? Yeah, so it's a nightmare situation. And I'm glad they found you. But it's very important. I don't know if you ever read any books by Brene Brown, but she says she's amazing research about communication, but she says clear is kind, right? What the kindest thing we can do is just be honest about what's going on. And so in that situation, what you were seeing was blatant racism, right? This person was being discriminated for no other reason that they were of a certain race. And, we're not here to tackle the political repercussions of that, but that is something we definitely have to address within healthcare. And I don't think that it needs to go down a path of like there is systemic racism. I would like to take a different approach. I would say there's a systemic lack of focusing on the patient in front of us, right? So I don't care what skin color you have or what your background is. When you have bacterial meningitis, we objectively can say you need a certain number of things. Right? Yeah. And you need them like yesterday. But, we've developed a framework we call for communication called the PATCH system. It stands for patient goals, autonomy, tailoring communication. The C is communication basics and H is humility or humanize the experience, right? And I want to take this to that T, the tailoring of communication, in 2 ways. Number one, oftentimes these populations that have encountered multiple barriers communicate in a different way. Unfortunately, sometimes they're resistant and they have high anxiety around healthcare, right? So they're less likely to give you the honest answer because you're like, oh, you're yet another person that won't care, right? But on the flip side, we have a huge opportunity to build a lot of trust with them very quickly by knowing that, addressing that, and saying, hey, let's move past that. So I'll use an example that everybody can understand. Imagine you had a small child coming in, and Marco, if I remember, we met in person one time. You're about 6 feet tall. Is that right?
You're right.
Yeah. I think everybody can understand, okay, if I were going to tailor communication to a child, it's recommended get down on their level, right? Take a knee, put them in a chair and kind of squat down, whatever. And what you're doing there to the child is you're signaling, hey, you're shorter than me. There's nothing we can do about that, but I'm going to actually meet you where you are.
Yeah. Perfect.
Yeah. And now when we get into racism, people want to judge about the political repercussions or where it comes from or whatever. But how did you learn to get, quote unquote, get on their level, tailor the communication to them? What were some tricks you learned in there to build trust with that population?
Great call. First and foremost, it comes from, and you're hitting a lot of key points in terms of just your own mindfulness, right? A personal reflection in of yourself, like how you actually operate. And through that kind of path that I was taking in terms of my own personal journey, I mean, irrespective of what we wear, who we are, what skin color, how old, blah, 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 we're all humans. Literally, we are. And one of a patient of mine told me this years ago, you have all these degrees on the wall. You can't buy a single loaf of bread with them. And he was absolutely correct about that. Irrespective of what I know or blah, 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 I know.
Yeah.
And so when I come to that, there's another thing that always keeps me in mind, Josh, that between myself or someone, God forbid, knock on wood, who's on the street, you name it, the fine line, it really is a tenuous fine line between us. Someone's situation and my situation can flip just like that. And that always keeps me, and you said the correct word, humble. Like I'm here. Yes, I'm in a healthcare business. I'm still here trying to make a living, but you're hoarding my information.
Mm.
And it's what kind of helps me with that communication aspect, that irrespective. And once again, we've been in those places where you literally you can't even get cell reception to use Google Translate to
Yeah.
right? Like, and you know what? You'd be surprised on how well you communicate with someone, even if you don't speak the actual, right? Absolutely. So that's what kind of keeps me grounded in the sense of humility. And there is no real difference between us. The only difference is, I have a certain knowledge that could help you. Let's go, like there's like, let's share that. And that's what I use for my own communication.
That's awesome. Along with that, speaking of that, in the U.S., I've talked to a lot of chiropractors work in the Midwest, and that's kind of our agricultural center of the country, right? And, they'll jokingly say, if a farmer ever tells you that he's hurt, you better believe him because they don't admit that. But if he ever hurts so bad he stopped working, that's a red flag.
Yeah.
Did you experience something similar in that mining town? Are they a lot of tough nuggets?
Josh, my friend, I've never had to, I was covering a maternity leave, and the doc was, she was a good foot shorter than me and probably, 30 or 40 pounds lighter. And I was stepping on it and seeing the individual she was manipulating. And I had to build up my own strength. So when you're talking about tough nuggets, absolutely, in the sense of just physically, just being able to make them pliable or to do what it is that you have to do. Absolutely. But also in that sense, you're absolutely, you're right, where they would keep on going. Yes, I might have this or that, but it's that mentality where there is no stopping. It's just
right.
Keep going.
Yeah. I think, when we talk about trust, that's another area too, because when those people with farmers, with miners, with NFL athletes or professional athletes, their body is their paycheck. Without it, they're done. And we're talking about things that would limit us. If you and I were in a different health profession, like mental health, for example, there's not as direct of a line between performance and medical care, right? They could have mental issues and still play at a certain level, but I don't want to discount that. I'm just saying, like, if you have a herniated disc, it's going to be really hard to sprint as fast as you get paid to sprint, right? But with that, was there any phrasing you learned, any terms that you learned to get them to accept the fact of, hey, I need you to back off or shut it down for a while, because moving forward, continuing this condition will just make things significantly worse?
Yeah. And I get this a lot with the quote unquote, like the weekend warriors, in a sense of, I think it was pickleball. All of a sudden, pickleball came out of left field.
That's right.
I would always preface this with patients, and I rarely tell patients no or don't. As I'm a firm believer, you could still, there's something that you could always still do. It's particularly to make activity, but it's the part and parcel where I always start off with, your body best, whatever degrees or however long I've been in this field, I tip my hat because you are in your body. When someone says something is wrong, okay, there's something wrong. Let me do everything I can to figure that out. Once we work through that process, it's kind of telling them, hey, this is where that trust comes on in. Letting them listen to what their body is telling them. I'm just the whisperer interpreting it, rephrasing it to them. You come to me for something. Listen, I'm just trying to let you tune into what your body's telling you. Backing it off or taking off 20% or modification is a really big key, not only to reach their health goals. It really built that trust where it's like, okay, they're working in the mines 12 hours a day, 7 weeks in a row with 10 days off, there's not that much they can do to modify their activities. But even if it's that little bit every single day where they're building that more of that awareness inside of them and eventually listening to it, can really impact their livelihood.
So allowing that, again, going back, allowing them the autonomy to make that choice and say, it's not Marco's opinion. This is, I'll give you the honest assessment, but you make your own decisions. Yeah. It's funny because that ability to choose, even as simply as say, listen, I want to see you 12 times. I can see you 3 times a week for 4 weeks or twice a week for 6 weeks. Even though that's the same volume of treatment, the perception of choice sometimes empowers them so much to just trust you that you're not forcing anything. You know what I mean? Like, no, I don't care. I just know you need this much treatment. Or, do you want to do all your exercises and stretches here with me? Or do you think you can do them at home? Giving them that choice to say, Mark, I'm not the kind of person who's going to do it at home. I'll just pay you to do it,
I would call that.
Yeah. But it matters to people, right? Because they can be honest and be a participant in their own healthcare. And I think that gets forgotten. Before we move on, going back to the imaging story you talked about, right? When you ran into these roadblocks saying, hey, I want to refer John for an MRI, and knowing that the other side might have known he's Aboriginal, or he's of some population that they don't embrace as well. How about that?
Good work.
Did you learn any methods to appeal to the other providers? Because as a general rule, what I find is it's a whole lot easier to be racist, sexist, stupid as a group. But when you get down to individuals and it's just you versus me, it seems like a lot of those labels come off, and we start treating people and individuals as that individual, and it's tough because in healthcare, like in a hospital, you might have a whole block of people, like all the hip replacement patients are this way. And you're like, well, they're not all that way. Like they have generalities, but they're not all that way. But did you learn any tricks to talk with those individual providers? And did you find that to be more successful?
Absolutely. And I just want to add to your point. You remind me of what my medical radiologist back in my fellowship days would always say. Great doc, 5 foot tall, and she was mean, but so great in terms of her wisdom. It can sound like a horse, look like a horse. It can still be a zebra, and that the conditions never read the textbook. And that's where you're like, oh, all hip patients are the same. No, they're not. Hey, they're all, it's maybe their hip, but the conditions don't read the textbook. How it manifests as you inside you is completely separate. One of the tricks, and Josh, honestly, and I'm thinking about this case particular, because I was just so frustrated because there's literally one hospital in town, and the nearest hospital was like, I think 2.5 hours one way, 3 hours another way. So it's like, okay, this is the only way it can get done, so to speak.
There's not a community imaging center like in Toronto. I'm pretty sure there's a couple on every block, right? Yeah.
Right. But when you're, in a rural area, it's tough. There's not, and once again, the healthcare system could be great, but there could be limited resources, right? And this just muddles it even more when there's that level of racism. I made a note, literally just sent it directly to the hospital, didn't put the doctor's name on it, just objective findings where I'm leading them towards, hey, cauda equina or bacterial meningitis. And I believe I put CSM as well too. I'm like, there is some incredible signs here. Here's my findings. This is what's going on. Just keep it objective as possible and presented it to them that irrespective of who this patient is, irrespective of who I am or who you are, here's something with all these signs. You can't ignore this. This is the signs. I'm not trying to burn, to set up a red flag, but these are red flags. You can't ignore these. And that's where I found that that's when they eventually got receptive. And they got the care. And once again, if he would have expired in 24 hours, I later found out he was flown 16 hours to a hospital within 2 hours after the note. So it worked out. I got to see him again afterwards. He was happy and healthy, but that's where I kept it towards. Okay, you know what? This isn't the patient showing up. This is just me being the quote unquote practitioner. This is just objective.
Almost like those government documents where you see they take the black marker and block out name, date of birth, whatever, and you're just like, hey, all you need to know is that he has cauda equina, or bacterial meningitis symptoms. That's all you need to know about the patient, not even him, right?
It reminds me back in our college days where you get these cases where it's just like, okay, male, 46, back pain. Okay, that's all you needed to know, right? Go, or blah 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 blah.
Right. You're like sprain, and then they hand you a card, positive imaging on the, and then you're like, well, I modify that. Yeah, I remember those.
Josh, though, this is and you being in Uganda, you see that's a whole nother ball of wax. It just sucks. People see a lot of things before they actually see the human being or where they can do their job. And that just sucks. And going back to a couple of points, that's patient-centered care. I always tell, you're in the driver's seats. When someone always says, oh, do what you want, I stop. I'm like, no, don't do what I want. This is your body. You can't take away what I do to it. Consent is always ongoing. You're in the driver's seat.
Yeah. Yeah, that's so funny. Then they think they're submitting, and it's like, well, what I want as a doctor is for you to drive. So there you go. I'll advise you.
Yeah.
Anyways, let's talk about a couple different situations with trust. So when you're doing this locum work recently, you're going into an office where they've seen a doctor of you were coming in as a 6 foot tall male, and you're saying that it was a 5 foot tall female. So that's different. She has to give you the rubber stamp of approval to say, this is the person I trust to take over. But I'm sure you had those people that come in and been seeing that doctor and built a trusted relationship over years. And then there you are standing and they're like, who the hell are you? What are you doing here? Yeah. How do you handle that? What have you found works to build that relationship back up?
Yeah, this is what we have to do, right? And this is going to sound so innocuous, Josh. Eye contact, smile, first and foremost. Like,
Marco, let me tell you, we all love evidence that supports great care, right?
Yeah.
Okay. If you look at, so I looked at PubMed research and then compared it to Google, because Google's hearing what consumers want, but they're doing really poor research. It would never meet the criteria for an IRB or anything, but they're looking at stuff that's great because they don't care, what the patient population was. They're just like, hey, who buys, who doesn't? Well, when you compare that to medical research. So here's a kicker for you. Guess what percentage of doctors entering the room for the first time introduced themselves by name?
Great. John, I'm gonna take a stab and say maybe 10% of the time they actually.
You're right, 10%.
Really?
Yeah, it's like 9.8%. We'll just round up to 10. Now, second thing, what percentage of doctors do you think greet the patient by name?
Oh, even less than that. I would say 5%.
Keep going down, buddy.
3%?
2%.
What?
Which is crazy because wouldn't it be amazing if we had some system where before we went in to see the patient, we already know their name and their history? Oh, we have that. It's called their chart. Like it's
utilized.
Yeah. So if you look at 10% times 2% to get to the top 0.5% of all of healthcare, it'd be easy. Introduce yourself by name and greet the patient by name. Like, Marco, hi, I'm Dr. Josh. It's a pleasure to meet you, right? Or even better, hey, I'm Dr. Josh. I believe you're Marco. And you say yes. Do you go by Marco? Would you prefer something else? Offer some autonomy. That would vault you into not the top 1%, into the top 0.1% of all of healthcare, right? It's crazy.
Sorry, continue.
No, I was just going to say, this is why Google advises or why MailChimp uses your first name in every email. If you get an email saying, hey, Marco, we're running a sale on tires at your local tire center, you're much more likely to open it than if it just doesn't use your name. Why would it be any different in freaking healthcare? And the stakes are a whole lot higher in healthcare than they are in the tire shop. But, when you go into a tire shop, what's the likelihood the guy will have his name on his chest?
There you go.
100%. Why? Because it matters. So in our patch system, that's a C for communication basic. But yeah, use their name, eye contact, shake their hand. This is not crazy stuff.
Yeah, and bear with me on this. And this was one of my mentors. He was the first chiropractor for the Toronto Argonauts, first chiro, I believe, at the Cleveland Clinic. Great guy. And he would always tell me, don't be a schlep doc. Always humility, share your wisdom, and just things of that where you just say hi, eye contact, reach your patient. Sherlock Holmes. I got into Sherlock Holmes stories a few years ago. Myself and my colleague would read up to the point where Sherlock would unravel it, and we would have these debates to try to figure it out, almost solving them a couple of times. But what got me was everyone was always so impressed. Oh, Sherlock, how can you see this? How did you solve this? Sherlock would always say, and I'm paraphrasing, I don't have any special powers. It's just the power of observation. He just served. When you go in there, say hi to someone, see how they're standing, eye contact, listen. People, and I'm sure you get this too, Josh. You're an amazing practitioner. Like, how do you do it? I don't, you probably, and I know you have that humility. You just, hey, I'm not doing anything special. I'm just saying hi, greeting them, treat them like a human being. And that, talk about trust, that knocks down barriers. It really reaffirms that connection where, hey, it's not a degree. It's not someone else in a white coat. It's not this male who's 6 feet tall. Oh my gosh, what are they going to do to me? Hey, it's Mark. Hey, I'm doctor. I always introduce myself as doctor first. So They know who I am. And then
Right.
please call me Marco. Some people would always say, no, I prefer to call you doctor. That's cool. You can call me call me whatever you want. I'm here to help, right? Whatever makes you comfortable. And that, my friend, right, in those innocuous little things, whether you're doing surgery or whether you're just helping them with a stiff neck, results happen, and they happen fast.
Right. Yeah. Yeah. I think that it gets overlooked so often. I mean, I don't know if you've ever been a patient yourself, but like kind of the worst scenario, I wouldn't say that I have high anxiety around healthcare. Like I understand it pretty well, but I've had a situation where I do have anxiety. I can remember a time I got hospitalized for this weird thing, and five or six or seven people came into my room, and they're coming in and they're doing stuff. I'm like, I'm sorry, are you the nurse? Oh, no. I'm just I'm just the med tech. Okay. But they almost have this idea of like, what, you should know that. I'm like, yeah, up till yesterday, never been in a hospital. So, but you've worked the last 10,000 days in a hospital. So of course you know it, right? Well, that's contrasted. I recently had about a year ago, had knee surgery because I was on vacation, slipped, tore my quad. And I thought the coolest thing there was a bunch of people came in. This hospital thought it through. The woman came in and her first thing is, hi, I'm Stacy. I'm with the phlebotomy team. You'll know that we're with phlebotomy if we're wearing red scrubs.
Hey.
Next person came in, hi, I'm John. I'm with radiology. Right? And you'll know radiology because we wear black scrubs. Hey, I'm with surgery. Surgery, you'll know, is always blue scrubs. Hey, I'm a nurse. You can tell by my green scrubs. So not only are they giving you their name, which was awesome, they're giving you context so that if you wake up in the middle of the night on pain meds in a dark room in a place you have never been for in your life, you open your eyes and you're like, oh my God, they're in black scrubs. That must be the angel of death. But you're like, oh no, that's radiology, right? Like, but I just thought, wow, what a contrasting version, But I'm sure you've been in a situation where you go to the doctor's office, somebody walks in to take your vitals, and you're like, are you the doctor, the nurse? They're like, no, I'm just the med assistant. And you're like, how would I know that? I've never been here before. I don't know your processes. And then another person walks in, doesn't introduce themselves. And then you're like, I'm sorry, are you the doctor, the nurse? Like, oh, I'm the nurse. Okay. Are you going to be treating me today? No. Dr. So-and-so's coming in. It's like, this doesn't have to be a fight. Just tell me who you are and what the context is.
Well, and how do we I don't know if they're Star Trek fans, but hey, all the red shirts are engineering, right? So sorry, all the blue shirts are medical, right? Like this is Star Trek has it down. Like, why the heck can't we? And you're right. That is really how they did that in that hospital. Brilliant.
Yeah. I was amazed. Yeah. And it just removed a huge amount of anxiety, So when it comes down to practical tips, by the way, if anybody out there has a clinic and you're thinking, should we wear name tags or not? I would say absolutely. And it should also have your role. So if you're, chiropractor underneath it, or surgeon or medical assistant or whatever, because that gives the patient context. And I always put this out to any of our customers. Find me a company that focuses really highly on service that doesn't use name tags.
Oh.
Yeah, I can't think of one when I go off the top of my head. So in the States, Starbucks is, you guys have Timmy's coffee, but we have Starbucks mostly. Starbucks always has your name on their chest, yeah. Right? Always. You think about who would you think of a company that really focuses on service?
Literally, as soon as you get the first thing that came, I guess this is probably good product placement, right? In terms of advertisement.
Yes.
Popped in my head as well, too. Like, it was just one of those things in terms of it's always the name, and they are supposed to write our names on our copies as well, too, right?
Yeah. Yes. I didn't think about that. That's another great way to connect with you, right? Writing your name on your coffee. Interesting. Yeah. That's incredible. Yeah. I was thinking like Disney, no matter where you go in Disney or any Disney store, any Disney ride, any Disney area, always a name tag. It's a standardized name tag. Nordstrom's, trying to think of anything else, but any high service, it's always got a name tag.
Yeah, absolutely. And I
like that. Yeah.
Oh, sorry, you're going back to when I was in Northern Ontario. That was we started off, and my apologies for vocalizing it. We started off with the name tag, and I kept it on for about a week or two until you kind of all the other patients started to see you and get used to you. And either way, that once again, I know we were talking in terms of barriers with racism, but we were even touching with this. There was that subtle issues about sexism, right? Like that male who's coming in to replace this female doctor. And it wasn't about to prove who's better, who's not. I would just always tell patients, hey, we graduated the same college. We have the same education. Her hands are her hands. My hands are my hands, right? That doesn't mean I can't do what she does. It just, my hands won't replicate what she does. And I'm a firm believer, Josh, once again, too, if you don't know, hey, I don't know. Like, it's okay to say, I can,
Yeah.
it's okay. Hey, step out, look
It's
at
that H in the system. It's humility, like asking, do you go by Marco? Or, like, I don't know. And it's perfectly okay for you not to know.
1,000%.
But I know where the answers are. I know how to get information for you.
That builds trust, because I will like tell patients, hey, I don't know. I'll look, and I will quarterback this with you. But if I don't know, I will bring you to the people or the person to go down that route, because why am I going to do something if I don't know? Then and they get hurt even more. And I find particularly in the healthcare, that can be a barrier within the self, which is a barrier to how many patients have we've heard where, oh, they did this, they didn't know. I'm like, if you don't, and now mind you, whatever someone's experience, their experience, but if you don't know personally, just tell them. You're not going to lose them. They will respect you for that.
Yeah.
They really that trust, right?
Yeah. One of the things that sticks out in my mind looking at the research, there's a study saying on what gets patients the highest, or what gets the highest patient satisfaction. And one of the insights that group had in the research was that anytime they noticed a spike in patient satisfaction, anytime a doctor made a mistake and then corrected himself in front of the patient. So if I go, hey, what's up, Mike? Oh, I'm sorry. It's Marco. I'm so sorry. If I do that in front of you, you go, oh, this guy's humble. He makes mistakes, but he knows that they're mistakes and he corrects them, right? Huge uptick. And they, even to the point where the researchers said it may be worthwhile for doctors to purposely make a mistake.
You draw, and there's this one story. I couldn't remember with respects to the type of depression that they were referring this to, but there's been thousands of studies linking exercise towards depression. So we know you're active. Okay, cool. The one study I read was they looked at people just driving and parking in the parking lot, just parking at the gym. They already reported better scores in terms of their overall wellness compared to depression. That's why I tell patients, I'm like, you don't need to do a lot. And that's another thing too. Just working with, I'm not trying to fit a square peg into a round hole. Conditions, textbook, you're giving them the plan of management. This is what I think works for you, not everyone else. And they love that. It's for patient-centered care, right? So but lots can happen.
Awesome. Well, listen, Marco, as we're getting to the end of this, I'd love to hear maybe a little bit of your insights of treating in Uganda. I mean, that sounds like a totally foreign concept to my career and my approach. But let's end on a high note. What were the best things, and what did you learn about treating in Uganda that people might want to hear? By the way, are there organizations that do this? If somebody listening has a medical license, are there known organizations like Doctors Without Border type that you can go and do care?
Question. I'm with Toronto, so I'm the musculoskeletal lead for a Toronto-based organization called Bridge to Health. And basically the Canadian version of Doctors Without Borders, in the sense of that we will go primarily in East Africa, and you will bring, infectious disease docs, emergency docs, just blah, 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 set up in completely rural or desolate areas, treat until the rains come, there is no more light, or you might feel threatened, and then you go. So Bridge to Health, we're always looking for volunteers. And Josh, how do I put it this way, man? I love to tell this story. I've never been camping. I never went camping. Before I went my first time, I don't think I was even off the continent. And all of a sudden now I am literally in like a third world country, rural area. And your threshold, one of the things I found was you quickly discover your barriers within yourself, and you quickly discover where your thresholds are. So just as a testament to be like, okay, this is where I am. But where I also found was it doesn't matter where you are, you could really bring a lot of help to a lot of people. And the amount of gratefulness coming back, my first patient that I treated when I was back in Canada 5 years ago from after my first trip to Uganda was a social media influencer where her half hours out of the day, she had to swipe right. So she ended up getting some issues with her thumb. And I'm just like, Josh, I'm not, dude. I'm like, it was just one of those things where, wow, I'm treating someone in Uganda who's never let alone like any medical care. They have
like electricity would be a leap.
We're talking about where we were treating. One of the areas we treated, we called it the spooky haunted house because there were holes in the brick wall. That was the only way to get light. Literally, that was the only way to get light in there. And then you're back and you're like, okay, your thumb hurts because you're scrolling for 4.5 hours, right? So
Yeah.
I get this. You will quickly discover your own boundaries. You'll discover you can do so much with so little. And there's tremendous amount of people out there who will be so grateful for the little bit that you can do. And it's a heartwarming, soul affirming thing. So yeah.
I love it.
Yeah.
I love it. How many like tours or mission trips have you done there in Uganda?
I've done 2 so far. We're setting up right now. I have a conversation tomorrow where it looks like we'll be planning for my next round in November. February, I'm going back again, and it looks like I'll be also going to Rwanda as well.
And how long do they typically last when you go?
Good question. It's about 2 to 3 weeks, but including travel time. So just to get to where I was in Uganda in February took about 8 hours one way. And then you got to come back. So that's the other thing too. It's a tremendous amount of trust. Someone's like, oh yeah, you're going to be in a plane, we got to go to Vegas, which is what, I don't know, like 6 hours. Yeah, it's okay. One of my shortest trips were 17.5 hours on a flight, right? So it's just things where it's a
Well, the other thing, it reminds you, I'm sure too, of what conveniences you've forgotten were convenience. Like if I say, hey, let's meet on the Las Vegas Strip, and I get there, I can text you and be like, hey, Marco, where are you? And you're like, oh, I'm at whatever. I don't know if you had text messaging, but even then, like, how do you even describe to where you are? Like, oh, I'm here. Well, I'm seeing the same thing, and you could be 100 miles away from each other, right? And it's just, and that's if there is text messaging. Imagine there's not, and what do you do then?
Yeah, and how many places were we in where there was no electricity? Like literally, we treat until it starts raining or it gets dark because you got to get back to your place before it gets really dark because there is no electricity.
Yeah, that's crazy. So, all right, well, Marco, this has been a pleasure talking to you. I really love your insights into how trust can pepper the relationship, and what are the barriers. Sometimes it's as blatant as the case you talked about, where it was just patient running into blatant racism, even though they have a significantly aggressive disease that would literally kill them if they don't get treatment. And I'm glad you're able to help that person out. And then I love the idea of you ending with telling us about the service work you do, which that's a fun part of healthcare, right? Like going and giving it to people who value it a little bit more than the insurance companies and whatnot that we oftentimes do all the work for, right?
Yeah.
Awesome. Well, Marco, if people want to follow you on Instagram, what's your handle?
Sure, it is Marco, MARCO.G.DC.
Awesome. And I'm sure there might be pictures of you in Uganda and doing all sorts of crazy stuff.
I got a bit of a crazy hair and a thicker beard, so don't be scared. But I mean, hey, if you can't drink the water, you're not going to be shaving with the water either. So,
there you go. Yet another insight. Yeah. All right. Well, on behalf of Marco, this is Josh Satterlee. I would say go out there, do what you can to build trust with every single patient. Thanks so much, Marco.
Thank you, Josh. Thank you.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust-Driven Care. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust-Driven Insights. Real conversations. Smarter care. Stronger business.